Well, do you know, it's a question that people ask a lot, and they often say to you, how will I know when I'm in labour? And I think the first answer to that is, you'll know. Believe me, you will know.
Nearly every woman that I've come across does know clearly when she's in labour. A week or two before labour begins, often there is a sort of limbering up phase of the uterus, and you might commonly go to bed and feel some crampy period-like pains.
Most women go into labour at or after 37 weeks of pregnancy. And there are 3 signs of labour starting. First of all, the waters might break.
With this, you feel an uncontrollable warm fluid, usually clear fluid, running down your legs, and it's sometimes confused with having wet yourself.
The other way that labour can start is with contractions.
And contractions feel like period pains, just more so. They're all low down in the tummy, just above the pubic bone. And when they're occurring about 2 every 10 minutes, that's the time when you should be thinking about ringing the midwife or the labour ward.
The third thing that might happen is a woman might get a show,
which is a bit of mucus or bloody mucus that arrives through the vagina.
If the waters break, most hospitals will recommend that you go along and have a check-up done. If you're not in labour, if the contractions haven't started, you'll probably be allowed to go home and come back 24 hours later. If the contractions start, what I normally recommend to women is that they stay at home to start with. First of all, to be sure that they are actually going into labour. There's nothing worse than starting to come into hospital and then finding not in labour and having to go home again. So I recommend that women stay at home until they're absolutely sure that the contractions are going to continue and are regular. And then the advice normally is to ring the hospital where you're having your baby and go in and have a check-up done.